Right to Life Radio with John Girardi on Power Talk 96.7 and AM 1400, a production of the Right to Life of Central California. And now, here's your host, John Girardi.
We haven't had him on yet to give his crackling commentary about the Fresno City Council giving $1 million to Planned Parenthood. But now he's here, and now he's ready to just unleash on the Fresno City Council with his fire-breathing commentary.
That's, you know me.
None other than Jonathan Keller from California Family Council. How's it going, Jonathan?
Good. I mean,
all right.
Jonathan Shock Jock Keller. That's my name.
We may prank call Nelson Esparza at some point during the
Why
broadcast and say, do you have Prince Albert in a can? You should let him out. Anyway, so I have a couple more thoughts. Because if there's one thing I'm never running out of, it's thoughts. And God forbid anyone I ever, not let the entire city of Fresno hear them, about the city of Fresno giving $1 million to Planned Parenthood. So for those who don't know, the Fresno City Council recently passed a resolution to hand on $1 million of state funding for the Planned Parenthood on Fulton Street. There's no bones about it. This is for abortion funding. They can say till the cows come home that this is for cancer screening equipment. I think what they meant by that, Jonathan, is that they were paying for ultrasound machine probes as part of this $1 million grant, which I guess you do use ultrasound probes to screen for cancer.
Cervical cancer, maybe,
Cervical
possibly.
cancer, yeah, I guess so, or, uterine cancer or
We know
something.
that they weren't using it for mammograms because no Planned Parenthood in the country offers mammograms.
Correct. That is correct. Which I believe Luis Chavez said something about mammograms being offered at Planned Parenthood clinics, which is incorrect. Planned Parenthood does not have a single mammogram machine in any of their clinics anywhere in America. Anyway, that was, by the way, a falsehood that originated from one Barack Obama, I believe. Isn't that correct? He gave some speech about Planned Parenthood funding. It's, they do mammograms. And it's like, well, actually, no, they don't. And everyone has kind of run with that ever since. So... and by the way, it should be noted, they got $1 million grant if they're getting ultrasound machine probes for the clinic, which was one of the things specified in the budgetary grant request. Ultrasound machine probes cost maybe like $1,000 a pop. So even if they were getting, I don't know, even if they got 20 new ultrasound machine probes, that there's still $880,000 of not that that's available. So... one of the things I've been thinking about more are like the public health problems in the San Joaquin Valley, how Medi-Cal reimburses how doctors used to take Medi-Cal patients, and how providing prenatal care for lower-income people is getting harder and harder and harder in the San Joaquin Valley, and how that impacts the way Planned Parenthood operates and the kinds of things we notice Planned Parenthood does offer and the things they don't. Okay, so stick with me here, Jonathan.
Okay.
So prenatal care,
Yes.
which is kind of a term of art, it means the range of checkups and appointments, ultrasounds, doctor visits that a pregnant woman has over the 9-month period leading up to childbirth. That is prenatal care. That is what the phrase means. It doesn't.
It is between the time that a woman gets pregnant and delivers the child.
Yes, so it doesn't mean literally anything prior to pregnancy. It doesn't include like contraception coverage. It doesn't include other stuff. It's a term of art that specifically refers to doctor visits, nurse practitioner visits, pregnant women coming in to have their checkups prior to delivery.
Okay, this makes sense.
Yes. And prenatal care is really, really important. It's an important part of preventative medicine. It allows you to catch problems before they get really, really bad. Women who get prenatal care before they deliver have, on the whole, much better healthcare outcomes than those who do not. Now, what's the fundamental problem with prenatal care in the Medi-Cal context? Okay, so Medi-Cal is our state's version of Medicaid.
Okay.
It is funded in part by the federal government and in part by state government. The way that the healthcare universe works, I'm just giving the 80,000-foot view here. Basically, you have providers, doctors, nurse practitioners who provide care, and you have payers, okay, insurance companies who pay for the service. Okay.
Yes.
The insurance companies collect revenues in the forms of premiums and deductibles and copays, and then they pay for the services you take advantage of as someone who is on that insurance plan. Medi-Cal is open to lower income people and is funded not so much through premiums and stuff like that, but it's heavily, heavily subsidized by our taxpayer dollars. Okay. The problem with Medi-Cal is that it's a government-funded thing, and necessarily because it's a government-funded thing, the amount that Medi-Cal is going to reimburse, that it's going to pay out for when people take advantage of the services, they can get away with reimbursing less. They don't want to pay out as much. It's taxpayer dollars. There's the more that Medi-Cal pays out, the more the program costs, and the more we would need tax dollars to cover it, et cetera. So there's this obvious necessary tension that Medi-Cal is going to reimburse poorly.
Because they cannot, I mean, just to put a fine point on it, they cannot print money
right
at Medi-Cal.
The state, the state government can't print money. Federal government can print money, but the state government can't print money.
Right.
So Medi-Cal is always going to have this tension where it's not going to reimburse as well as a private insurance can. Okay? And in prior years, doctors knew this. They knew that Medi-Cal did not reimburse very well. However, in a lot of different fields, doctors would view it almost as their kind of public service to take a certain amount of Medi-Cal patients. Even if they don't make a lot of money, or if they just break even, at the very least they thought, well, I'm doing my part for the community. I'm helping lower income people. This is it's almost like, lawyers who take on pro bono clients. Like this was a kind of public service almost. The problem is for prenatal care and OBGYN care in general, OBGYNs can't afford to take in Medi-Cal patients because Medi-Cal reimburses so poorly for OBGYN services, for prenatal care, that doctors are actively losing money on a patient. So as a result, these doctors are like, well, I can't just keep taking these patients in. I'm going to lose money.
A limited number, but essentially, John, if I'm understanding, basically you have the OBGYNs in private practice that they have to maintain, as you said, not just a tension on the reimbursements and everything between the federal government, but there's a tension of saying, I need enough full freight patients that are going to offset the Medi-Cal.
Yeah.
Because if you're losing money on patients, you can't make it up on volume.
Right, exactly. or if you're, maybe what you can do is you stack in so many Medi-Cal patients that you have so many people per hour that's a more efficient use of your time, and you're churning out, instead of 4 patients an hour, maybe it's 6 or 8 patients an hour or something, and then you can, I'm just pulling these numbers out of thin air, but then you can get more revenue per hour and you can keep the lights on. Okay, so as a result, fewer and fewer doctors' offices, fewer and fewer clinics want to take Medi-Cal patients. So unless you're an FQH, a federally qualified health clinic, which gets subsidized by the federal government, like you have no incentive to want to take in Medi-Cal patients. So let's look at Planned Parenthood. A huge percentage, I'm sure, of Planned Parenthood's patients are Medi-Cal people. Yet, what are the things that Planned Parenthood focuses on? They have contraceptive care, abortions, which bill really, really well. It bills much better than prenatal care. This is the thing with prenatal care, okay? Prenatal care takes up exam room space. It takes up doctor time, because you have to have a doc look at someone every so often. It takes up nurse practitioner time. So it takes up your exam room space, it takes up doctor time, it takes up nurse practitioner time for a service that bills really poorly, for that reimburses, rather, really poorly. So why would you provide prenatal care if you're Planned Parenthood? All your patients are Medi-Cal. You know that. Why would you provide prenatal care when you could instead put more of your focus and emphasis on abortion? Abortion, which reimburses so much better than prenatal care.
And which, tragically, there is it is much. I won't say it's more societally acceptable, but it is more acceptable among certain segments of the highly elite community.
Right. And beyond that,
you don't see Mackenzie Scott given $275 million for prenatal care.
Sure, exactly. And one of the things you've noticed, I'm sure you've noticed this, Jonathan, Planned Parenthood has gotten really into transgender healthcare, transgender hormonal treatments, and things like that. They've gotten into that while in many of their locations still not providing prenatal care. Okay, the Planned Parenthood clinic on Fulton Street 6 years ago, it didn't have prenatal care and it didn't have transgender, hormonal, LGBT, whatever care. Now they have transgender hormonal health treatments. They still don't have prenatal care. And at first blush, someone would think, well, that doesn't make sense. Isn't it a reproductive health clinic? Why wouldn't they have prenatal care? Well, transgender hormonal treatments reimburse really well. It's expensive. Okay? It reimburses well. So again, if you're Planned Parenthood and you're looking at the bottom line and you're looking at your clinic flow of what services am I going to provide in this clinic to have the most patient flow and generate the most revenue per hour, get the most bang for our buck, for our provider buck, for our exam room buck, what are we going to provide? Are we going to provide prenatal care? Heck no. We're going to provide these transgender hormonal health things. We're going to do everything but prenatal care because prenatal care is expensive. It takes time. You might be losing money on your Medi-Cal patients. It doesn't reimburse well.
And John, it's also ongoing. So it's not like, well, I'm going to do this one service that is a one and done, and I'm not making a bunch of money, but at least I'm done with it.
You've got 9 months worth of these checkups for each
patient.
It's
a recurring drag on your time and on your resources, and you're not making anything off it.
So the idea that let's give some Planned Parenthoods do prenatal care. Every financial incentive that Planned Parenthood has is not to provide prenatal care. Every financial incentive Planned Parenthood has is not to encourage women to keep their babies. Every financial incentive Planned Parenthood has is to abort more kids. Why? Because of money. Because of filthy, stinking money. That's what it is.
Yep.
So the idea that this is for Planned Parenthood does so many other things. They do cancer screenings. They do prenatal, which they don't even do prenatal care at the clinic on Fulton. Their whole business model is predicated on churning out abortions. And that's the real tragedy of Planned Parenthood. We'll talk about the noble claims and the harsh reality of all this next on Right to Life Radio. Talk about aliens. That's right. Giorgio Moroder with, I think this is like the bumper music for Coast to Coast with George Norrie. I promise you this segment we're not going to talk about UFOs here on Right to Life Radio. As always, a production of Right to Life of Central California, rtlcc.org. All right. Jonathan, so as we're discussing more about the Planned Parenthood business model.
Yes.
One of the things I want to point out is, so Planned Parenthood obviously is going to have this financial incentive to do more and more and more abortions and less prenatal care. As we sort of pointed out, Medi-Cal reimburses poorly for OBGYN care, for prenatal care especially. Prenatal care involves a lot of doctor time. It involves a lot of exam room time. It involves it's time consuming and it reimburses poorly. So they're obviously not as incentivized to do that. They are more incentivized to do abortion. And as a result, that's precisely what they do. The Planned Parenthood Clinic on Fulton Street does not offer prenatal care service. They offer abortions. They offer various forms of contraception. They offer hormonal treatments for like transgender persons and things like that, because again, these are all things that reimburse at better rates. They don't offer prenatal care. And this is, of course, one of the big public health problems in the San Joaquin Valley, is that there aren't a lot of places that want to take Medi-Cal patients for prenatal care. We have a huge number of Medi-Cal patients, very few places that want to take it. And that's, I think, this is maybe one of the most condemnatory aspects of most easily condemned things about Planned Parenthood and how they operate, particularly locally, is that
condemnatory. That's a good
things worthy of being condemned. Maybe condemnatory isn't the right thing.
Contemptible.
Contemptible. There you go. They're a nonprofit, and they're a big nonprofit. They're a big nonprofit locally. They're a big nonprofit nationally. And that's the point of being a nonprofit, is that it's maybe okay if you operate something at a loss, because then people can just donate money to you in a tax-deductible fashion and help make up the difference if you want to do something that is noble and benefiting the community, but not exactly super profitable. So that's the whole point of a nonprofit. That's the whole point of nonprofit status, right? I mean, that's the point of it. It's not something that's generating a lot of money, but it's something that's beneficial for society. And so as a result, we don't tax it. We allow people to give to it in a tax-deductible fashion.
And John, I want to point out that nonprofit is a section of the tax code, of course.
Right.
501c3 is the specific, nonprofit section of the tax code.
Mm-hmm.
But oftentimes I hear, in recent years, I've heard people point out that it's a section of the tax code, but it doesn't usually describe what an organization actually does or is supposed to do. So I have heard the more positive, proactive description of these types of organizations. It's not just a nonprofit, but we are a community benefit organization.
Right.
And by definition, you are a nonprofit and you are doing something for the benefit of the community.
Right.
And what could be much more beneficial for the community than ensuring that the next generation of people
exist?
And not only exist, but their parents are able to provide them prenatally with care.
Right. Well, especially for a so-called reproductive health clinic that
helping you plan parenthood.
Yeah, the one thing that they don't do is help you plan your parenthood or help you to actually reproduce.
Yes.
And that's, I think, the worst part of all this is that, well, Planned Parenthood says, well, it's they're basically acting like and operating like a for-profit doctor's office. I have more sympathy, frankly, for a for-profit doctor's office where the doctor, they need to pay their staff.
Sure.
They need to pay their rent. They need to keep the lights on.
And
they have to pay their taxes.
And there are lots of, we'll use an example. I know your mom has kind of joked about this. You've mentioned it on the past shows. There are lots of for-profit medical services or within that arena, like tattoo removal. You've mentioned in the past.
Yeah.
That is something that is not medically necessary, but it is something that is
medical adjacent.
Well, and it is for profit. And I don't think anybody would begrudge a dermatologist like Dr. Sharon Girardi from saying, "Hey, I'm going to charge you X dollars for this completely elective procedure that you are choosing to undergo."
Right.
Of course, you should make money off of that.
Right.
For profit.
Yeah, and that's the frustrating thing, is that Planned Parenthood, as a nonprofit, is positioned to take on patients for whom they won't make any money, for a service that's urgently needed locally, and then to fundraise to help meet that need or get government grants to help meet that need, and they don't. Instead, what do? They work to expand abortion services. They get $1 million grant to help them further expand their abortion services and make even more money. We'll be back with more on Right to Life Radio. Jackson Brown on Right to Life Radio. Always one of my faves. Thank you all so much for listening to Right to Life Radio, a production, as always, of Right to Life of Central California, rtlcc.org. All right, it's coming this November on your ballot. Proposition 1. Proposition 1 is the abortion, putting a constitutional right to abortion right into the California state constitution. Could very well wind up completely removing all restrictions from third trimester abortions in California, etc. It's really, really bad. Jonathan has been monitoring this really closely, and Jonathan has some polling data regarding Proposition 1 that is both that is maddeningly frustrating, if at times hopeful, but still maddeningly frustrating. So I think the difficulty is what people see when they look at what's on the tin for Prop 1. What people see on the tin for Prop 1, they seem to like.
Right.
But when you dig deep into what Proposition 1 does, it's something that people would not really like. The problem is they're only going to vote for what they see on the tin in all likelihood. So anyway, maybe try and explain this, Jonathan.
That's right. So let me read you. First off, I'm going to take you, John, on a roller coaster of emotion.
Yeah, go for it.
Courtesy of at least 3, if not 4, different public polls here. Number one, a couple of weeks ago, there was a poll that came out from our friends with the California Catholic Conference, a group called McNally Temple. They did a whole thing where they were talking about opposition to late-term abortion, and they conducted this poll back in June. I think it was June. It was before Dobbs had officially been decided. And it was after the leaked Supreme Court draft, but it was before it was finalized. And they said, hey, what are your opinions on abortion, generally speaking? How do you feel about late-term abortion? How do you feel about when life begins? All these types of things. And one of the things that was fascinating was they found out that, only 30% of Californians, according to this poll, support late-term abortion. 59% oppose late-term abortion. So they went down and they broke it down further, and they said, well, how does this break down? Well, among Republicans, unsurprisingly, among late-term abortion, it was only 8% of Republicans supported late-term abortion.
Sure.
88% opposed it.
Right.
That's great.
Yeah.
Independents, it's 24% support, 60% oppose. Great. Even among Democrats, it is only 45% support to 40% oppose. So it is, now there's some undecideds factored in there, but the only group, John, that where there was when they broke down these crosstabs, there were only 2 groups where there was a true majority of people who supported it. And this was, tragically, people under age 35.
Right.
Which doesn't give me a lot of hope for the future of the country.
Yeah.
Under age 35 was 51 to 40%. So that's still barely enough. And then it was Democrats under age 55. So Democrats under 55 were 56% support to 30% opposed.
But the general California populace, I mean, the big takeaway is, for the most part, the California electorate does not like late-term abortion.
Right. And that was the thing here. So there's this poll that came out, and it said, hey, it will not restrict. And I'm sorry, it is something we don't like. 59% to 30%.
Okay.
So there was that.
So that's positive.
That's positive. That's
but,
great news.
But then, I mean, the challenge is, how do we message to people that Proposition 1 legalizes all these things that people don't like? And that's really the only change it's making, is legalizing third trimester abortion, which, again, most Californians don't like third trimester abortion. And I think the problem is, what most people are going to see and read is the stuff that's outside the tin of Proposition 1, which is a legal right to abortion. So maybe, Jonathan, let's go into the sort of disappointing numbers about what the outside appearance of what people are supporting when they support Prop 1.
Well, so there's that one, and this is again where I say that it's a difficulty of the the difference between looking at things in a vacuum and looking at things as how they actually sound on the ballot. So the second proposal that came out, that was, I should say, let me look here and see.
Okay.
This was the one that I mentioned, was this private poll that was conducted, though, before Dobbs came out.
Okay.
Well, then there was a second one that came out, a second poll that came out, and this is from Berkeley. There's at least two polls, but the only one I'm going to reference right now is Berkeley.
Okay.
And this is from a Political article just a couple days ago. They said an overwhelming majority of California voters have abortion on their minds as the November election approaches, according to a poll released just this last week. I guess it was on Wednesday, the 24th of August. That also shows strong support for a ballot measure responding to the Supreme Court decision to overturn Roe v. Wade. Now, John, remember, 60 roughly, I'm going rough numbers, 60% to 30% oppose late-term abortion.
Right. Okay.
But now the contrast. More than 80% of registered voters consider abortion to be important in the upcoming election. And 71% plan to vote for Prop 1, an amendment to the California state constitution that would prohibit the state from interfering with a woman's right to an abortion and guarantees access to contraceptives, according to a poll from the Berkeley Institute of Governmental Studies.
Okay, so this is our fundamental problem.
Yes.
Most Californians don't like late-term abortion.
Yes.
But an enormous majority of Californians seem to be supportive of Proposition 1 because Proposition 1 is being sold as simply affirming a right to abortion in the most general sounding and generic terms possible. And what I think most voters are making the mistake of is not realizing abortion's already legal in California. It's already widely protected. All Proposition 1 could do, if it's going to change anything at all Prop 1's going to do is legalize the one form of abortion that Californians don't like.
Right.
Which is third trimester abortion. And so this is my fear with all of this is, well, how do you message that Prop 1... The problem is Prop 1 just says a constitutional right to abortion, which most Californians are going to say, oh, that sounds great. But they're not digging into it enough that they, clearly the answer is for everyone to listen to Right to Life Radio. They're not digging into it enough to know that, no, what this is going to do is legalize third trimester abortion. So I think that's the problem here. The sort of fundamental problem is between what people, it's almost like how people used to constantly say they supported Roe v. Wade in spite of the fact that they opposed all the things that Roe v. Wade mandated, like, legal late-term abortion, all that kind of stuff. I think it's people just can't get past the initial, perception of what this ballot initiative does.
Right.
Yeah.
And so let me tell you then the contrast. I'm giving you this roller coaster of polling data.
Okay.
You had the one poll from our friends at McNally Temple. Then you had a poll from Berkeley. Then you have another poll from Rasmussen. And it's funny, John, to me, it makes sense. But the top line articles on this, the Politico story, if you remember, says California ballot measure to guarantee right to abortion has strong support among voters. Poll finds. If you go look at some other ways that they were wording this, there was one line that said, let's see here.
Well, and that's the frustrating thing with some of these polls is that basically it's like you have issue polling, but then you have polling on Prop 1.
Right.
Okay. When you poll people on the issue of late-term abortion, they say, oh, yeah, late-term abortion, that's terrible.
Right.
When you poll them on Prop 1 and you give them the language of Prop 1, they think it's wonderful.
Right. So let me actually get to this. So this says this is from the LA Times. They actually say proposal to put abortion protections in California Constitution appears headed for victory. Well, yes, I mean that is objectively true. But then here is the Rasmussen report. It says most California voters support limits on abortion. Mm-hmm. Well, yes, that is technically true.
Yes.
If you ask people, do you support a limit on abortion, then the answer is yes. Now, let me read you down here. If you go down and look and you say, hey, do you think abortions after fetal heartbeat develops should be legal under any circumstances, only under certain stances? Well, you say, okay, yes, it's true that if you look and say, okay, well, after fetal heartbeat, this isn't just talking about late term, John. This is talking about just in fetal heartbeat, which is 3 weeks to maybe 6 weeks at most. Okay, well, 6% not sure, 10% illegal always, 48% legal only under certain circumstances. Well, that's 64% say, hey, fetal heartbeat, that should mean abortion should only be legal under certain circumstances after that. I oppose a blanket legalization of all abortions after fetal heartbeat, which is absolutely what Prop 1 would do.
Right.
So on the surface, it's like, wow, that sounds great. But then you get down to the bottom here, and they ask in this same poll from Rasmussen, do you support or oppose California's Prop 1? Now, so remember, this is the same poll.
So basically what's going to happen here is people have supported every kind of restriction that Prop 1 would outlaw.
Yes.
And then at the end they say they support Prop 1.
They say in this same poll, I'm not mixing polls. This is the same group of people that are getting asked the same questions in the same poll. After you've gotten asked all these questions about, well, which type of restrictions do you oppose, support, blah, 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 blah. They say, do you support or oppose Prop 1? Which states? The state shall not deny or interfere with an individual's reproductive freedom in their most intimate decisions, which includes the fundamental right to choose to have an abortion. All right, so you've been asked all those questions. Do you support this? 47% strongly support. 19% somewhat support. So that puts you right there at 68%
so
in favor.
You're at almost 70% in favor.
You're at 68% somewhat in favor. And then they say, well, if it omitted the right to have an abortion in the third trimester, would you be much more likely, somewhat more likely, blah, 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 to support it? Well, they say 45% say, oh, yeah, I'd be somewhat or much more likely to support it. Only 30% say, well, if you took that away, I'd be less likely to support it.
Yeah,
of course, people are going to say that, most likely.
So, but again, we have just this fundamental issue here is people like Prop 1 completely illogically.
Right.
They like Prop 1 in spite of the fact that it bans the kind of the kind of reasonable abortion restrictions that they would favor. So we are kind of screwed.
Well,
a little bit.
And the problem on this, John, is, again, being totally honest, this is a massive problem for the pro-life movement, the pro-life community moving forward, is that we are a nation of moral schizophrenics.
Yeah, well, it's almost, I think, people just don't like to think about abortion very much at all. I think that's maybe the key.
I had a conversation with a couple of my liberal friends, and I said the real median position on abortion is I don't want to think about it.
Right, and it results in people having completely contradictory views because they want to think about it as little as possible. Just sort of see the headline, some kind of right to abortion is okay, that's fine. But they don't want to third trimester, that sounds really gross. Okay, no third trimester abortion. But, people want a right to abortion? Okay. And they don't realize, and people have had that viewpoint about abortion for forever.
Yep.
And I think that's what's going to ultimately wind up biting us in the rear end here in California, is that's how people are going to vote for Prop 1. We'll have more analysis of that right after the break. This is Right to Life Radio on Power Talk. Right to Life Radio. Thank you all for...
Go take an Irish hike.
Go take an Irish hike. Go take a long walk off a short pier, Bono. All right. See, Bono's the thing of insufferable artist whose music I don't even really like that much, as opposed to like Bruce Springsteen or people like that. So you've never heard a U2 song on Right to Life Radio, and you never will. Now,
I guess, John, you could say that if someone comes here
looking for that,
they still haven't found what they're looking for.
No, nor will they ever. They should go look where the streets have no name.
There you go.
They should, or they should go look on their iPhone to see if they still have that stupid album that they tried to download onto everyone's iPhones back in 2010 that no one can ever get off of their Apple devices for the following 10 years.
She moves in mysterious ways. That's all I'm saying.
All right. So, as we are closing out the segment about Prop 1.
Yes.
I got to admit, everyone, I'm not going to paint some false picture. We're probably losing this Prop 1 thing. The fact of the matter is that the overwhelming polling evidence is when you just ask people with like the quotes of what Prop 1 says, the actual change, the actual wording it inserts into the California Constitution, an overwhelming majority of Californians support putting that phrasing into the California Constitution.
Right.
And as a result, if that's all they say in the ballot description, and by the way, who's writing the ballot description for every ballot initiative on the ballot?
I was going to say Javier Becerra because I'm just it's a
Yeah.
a reflexive. I forgot that he's not the AG
Yeah,
anymore.
Rob Bonta, who's
That's right.
possibly worse. Okay.
And John, okay, I just have to say something really quick on this.
Well, you're on a radio show, so go for it.
Oh my gosh, we might have talked about this before, but Rob Bonta, if you thought it was hard to stoop lower on abortion than Kamala Harris, I give you Javier Becerra. And then if you thought it was harder to stoop lower than Javier Becerra, I give you Rob Bonta. And the reason I say this, the reason this is a big deal, back in May of this year, May 11th, the Sacramento Bee wrote this article, California Assemblywoman Mia Bonta and Attorney General Rob Bonta share their abortion story.
Yes, so Rob and Mia Bonta had an abortion
Yes.
themselves.
Yes.
And so this is kind of a lot of their abortion advocacy seems to be sort of springing from their own personal experience of
Yes.
this as successful attorneys and politicians.
And they basically, I'm not going to read you the entire thing, but this is Mia Bonta. She's not being shy about this. She says, he held my hand. Bonta share abortion story, push for California reproductive rights. This is in May. This is in the immediate aftermath of the Dobbs leak. And I'm not going to, John, we're out of time, so I won't even read the whole thing. But the long and the short of it is that this was their child together. They were both in law school. They had been in, they were working on their Ivy League education, and they made a decision together, even though they loved each other, even though they were both highly educated, even though they were both, they both have gone on to these careers in California politics. They decided to abort their own child just because, basically, for their career prospects in the future.
Yeah.
Literally, quote, I chose to make a decision that would allow me to recognize the ending of the cycle of poverty in my family.
I mean, they were both in law school. It seems like that had already... I mean, there are women I know of who are pregnant in law school, who graduated law school, who've done... I mean, it's so sad because on the one hand, it's like you don't want to be there, like, raining down judgment on their subjective decisions, but at the same time, like, your child's life was worth more than a law degree.
Yep.
It was worth more than being, it was worth more than this.
Yep.
And, geez Louise. Yeah.
And that's the person
and
who is going to write the ballot
so
language.
he's going to write the ballot measure. So, we want to give people hope. We want people to vigorously and earnestly oppose Proposition 1, but, we're not in the business of...
Copium.
Wow, yeah, we're not providing you with copium, so that's not what we do on Right to Life Radio. All right, well, folks, that's going to do it for us. Thank you so much. We will see you next time on Right to Life Radio.